Committee members, do we have the book? Do we have the roll? Oh. Yes, thank you.
Brian,
Here.
Parker, here. Barnett, Blackwell, Blunt, DeBar, Billingane, Frazier, Harkins, Hickman, Hill, Hobson, Johnson, McMahon, Parks, Polk, Tate,
Here.
Turner Ford,
Present.
Wiggins. Mr. Chairman, we have a quorum.
Thank you. I'm trying to be fair to members of the committee and deal with the hectic pace that we have, so we're doing the best we can. I'll call up Senate Bill 2041. It is a grant program for the Department of Health to make grants to qualified health centers. It is scheduled to repeal. This extends the date of the underlying language to 2026. Actually, this will be dealt with in the appropriations bill. This bill is doubly referred to appropriations. If we pass the bill out of committee today, it gets it to appropriation so they can act on the bill if they desire to do so. And then, of course, the appropriation language in the appropriation bill at the end of the session will determine how much money, if any, works its way to there. But if that's what the bill does, are there questions? If not, is there a motion? The motion is title sufficient to pass. All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2727 is also doubly referred. Is Senator Boyd here? Then she may have other obligations. This is before us because it's doubly referred. It sets up a task force to study youth mental health. I've been contacted by this by a number of people. Senator Parker, do you want to speak to this bill?
I think your explanation is good. I know Senator Boyd is looking very closely into this issue and is hoping to, as she always does, gather further information through the use of this group. Yeah, so at the appropriate time, I'd be glad to offer.
I see she got you to co-author.
She did.
You did. So it has to be good. Would you like to make a motion about this
The
bill?
motion will be title sufficient to pass.
We ready to vote? All in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2161 is a bill, and I'm going to suggest we have a reverse repealer. This is the story of 2161. Years ago, in an effort to restrict cost of hold down cost of the Medicaid program, we would grant certificates of need with a provision that the grantee would not participate in Medicaid or would not fully participate in Medicaid. This is a facility in DeSoto County that has one of those restrictions. So you're sitting there with a facility, as it's explained to me, that has Mississippi Medicaid patients in much of the facility, Tennessee Medicaid patients in the other facility, and the Tennessee patients are there because it's not possible for the institution to accept any more Mississippi Medicaid patients, notwithstanding that there are Medicaid patients in the state of Mississippi who need the treatment, and some of whom are even going out of state. So that's what the bill would do. This is part of a bigger picture concerning availability of psychiatric care throughout the state, and there are many notions about what to do about it. My thought is, as the session goes on, we need to make a comprehensive decision about what we think we can bite off this session and do this session. This clearly needs to be a part of the mix, and by passing the bill with a reverse repealer, it will make this proposition available later in the session. So that's what it does. Is there a motion for a reverse repealer? Senator Barr moves for reverse repeal. All in favor of the amendment, say aye. Opposed, no. The ayes appear to have it. The ayes have it. And now we need a motion title sufficient to pass. All in favor, say aye. Opposed, no. The ayes have it. Thank you. I appreciate your coming. We'll meet tomorrow at 3. Sorry for the pace. No.